And back. And forward.
Oh my gosh. Yep. Oh my gosh, that was really tender.
All right, Tiffany, so tell me what's going on with your foot.
I think I have what they call plantar fasciitis. Every time I wake up in the morning, I'm in pain, and it kind of like takes a while for me to kind of get my stride, get my step going. It's just painful just to walk every morning, typically. If I'm walking during the day, it's no problem. But just literally the first thing in the morning, or if I lay down in bed for a while.
And it's both feet or just the one?
Is both.
The first few steps are the worst, and then when it warms up a little bit, it's better. And then when you...
It's like that morning is probably the worst of it.
And does the pain radiate anywhere? Does it go to your toes? Does it go up your leg?
No, it doesn't. It just literally stays all on the bottom of my feet. It's like tiptoe to the bathroom. I'm literally like hanging onto the edge of the bed. It has me hunched over. Like if I am walking, now I feel it. I literally felt it, after sitting for a little bit. It feels like it's more of like the outside, not really the arch. But like I literally have to kind of like get my stride a little bit, get going, and then I'm like, okay. And by the time I get to the bathroom, I'm like, I'm fine.
Okay, so it works out fairly
quickly. It works itself out, fairly quickly.
All right, so generally speaking, what happens with plantar fasciitis, the fascia, it's sort of a misnomer a little bit. It is fascia, but it functions almost like the tendon for your toes to move. And what can happen over time is that the tissue gets thicker and it starts to yank on the heel bone. Typically because connective tissue is not like muscle. Once it's heated up and it's warm, it's more malleable. So typically when you've been in one position, particularly with your toes pointed, so a lot of people, they'll notice if they can either wear like a dorsiflexor while they're sleeping, or some people untucking their sheets keeps their toes from being pointed all night. That tends to help as well. And then also having like something soft to step into instead of stepping on a hardwood floor immediately. In the traditional medical world, they can try corticosteroid injections, which it's not really inflammation unless the bursa is inflamed also. So more than anything, it's numbing it. That numbing sometimes can allow you to walk and stretch it out because the pain causes you to limp and not stretch it. So that can be effective sometimes. There's also some treatments called extracorporeal shockwave therapy. So it's acoustics. And then, when things get really crazy, what they do is actually cut the fascia itself. So they do a fasciotomy.
I've never been a flat-footed person. And I have noticed that my foot is falling a little flatter to the floor. It's your arch falling, right?
That could be part of it for some people. Everybody genetically has kind of different arches by sex, race, age. Now, a change in your arch definitely can lead to problems. So if you've had a certain type of arch your whole life, and then you have a trauma, or you start wearing shoes or something else that messes you up, it's pretty common to start having other problems with it, whether it's, inflammation between the bones. Some people get what's called a Morton's neuroma. Some people get bunions. Some people get plantar fasciitis. So there's a lot of other foot conditions that can go along with it. And one of them is peroneal tendonitis that looks like plantar fasciitis. Like the tendon on the outside will wrap around to the big toe.
Okay.
Typically, when you have that, the traditional methods for plantar fasciitis don't work because it's not actually plantar fasciitis.
Is this reversible?
Once we get the fascia looser, if this is what we think it is, then there are some exercises that we can show you for you to work it on your own to where it becomes kind of like, brushing your teeth. Spend 2-3 minutes, get rid of it, beat it back. Okay, let's take a look and see what we can do. I'm just gonna do that motion. Any pain there?
No.
Okay, anything there?
Nope.
No tension, it doesn't connect to anything. Okay, and if I do that?
No.
Anything there? Anything there?
No.
Okay. And then pressure-wise, anything there?
No.
When you get pain, it's not on that side.
It's one of those like feel-good pains. Like it's tender, but it feels good because it feels like it's being like worked out. Okay. So it is tender, yeah.
So it's more tender there, but nothing like there.
No, nothing shooting.
So it's mostly just the arch.
Yeah.
It's not yanking on the heels so much. Because when people really get plantar fasciitis bad, most of it's going to be like right there. That's like the ice pick point. And then it's definitely going to hurt up in the arch too. Hey, have you guys heard of Vessi, the sneaker company? They make comfortable, waterproof, and snowproof sneakers that you can wear anywhere. And I'm thrilled to have them as the sponsor of today's video. These sneakers are versatile and stylish enough to wear daily in unpredictable weather. They have the look and the feel of a lightweight knit athletic shoe that you would never think is waterproof. The unique dual climate Dymatex material keeps your feet dry and warm in the winter and cool in the summer. The antibacterial insoles keep things fresh. I travel often to film these videos for you guys, and I love that my Vessi shoes will be perfect to travel with regardless of the weather from city to city. The quality is amazing. I'm on my feet all day while treating patients, and these are comfortable, lightweight, and breathable. A great investment to wear year-round. I live in the desert where it doesn't rain or snow much, but I still wanted to put my Vessis to the test, to know I'm prepared for any weather situation with these shoes. As you can see, these are truly waterproof. Man, I'm impressed. If you live in a rainy or snowy climate, you should definitely try a pair of Vessies. The new Everyday Move shoes just launched. It's the perfect sporty look for active lifestyles with its enhanced breathability and added support for all-day comfort. Vessies are my new everyday go-to shoes. Check out Vessi at the link in the description and use my code to get $25 off your order. When you step, do you feel it here?
In the mornings, it literally feels like it's all over.
Okay, it's more on the outside than the inside?
Yeah, it does feel like it's on the outside a little bit
So you have like more around those areas.
That, I mean, I'm not gonna say I'm in pain, but I can feel like a ting, like.
Okay, let's flip over in your stomach. So we're just gonna work through both arches and see how much, there's definitely tension in both of them. So your feet are flexible, but you definitely have some like tension like straight in there.
Yeah, it almost feels like, yeah.
Yeah.
It almost feels like pressure point.
Yeah, totally.
Yeah, that is tender.
Yeah. So like a lot of what you feel is like there and
Yes.
there too?
Yep.
Yeah. Okay. And let's just get a shot of this arch angle because I'm actually gonna build them up a little bit. Something's afoot.
It's a funny series.
Yeah.
Hammering on a foot.
Yeah, become a total heel. It's a heel turn.
That is very tender. So it's almost like just pushing the heel back in place.
Right now I'm working the fascia.
Okay, so breaking up fibers.
Exactly. So it's gonna suck a little bit and you know, just like the other stuff, it'll start to ease out.
Yep, it's sucking. I mean, it sucks. I mean,
Definitely sucking.
that really does hurt. Oh my gosh, that is.
So there's a lot of theories out there. A lot of people
Gotcha.
believe that you hold your arch with muscle tone.
Yeah.
I tend to not be in that camp.
Okay.
I think most arch is, osseous, it's bony positioning for the most part.
Okay.
And then if you're doing that, what happens is all the ligaments that hold the bones together are stretched and weakened over time, which leads you to being flat-footed. There's nothing wrong with having flat feet.
Okay.
Most people that have flat feet are just born that way. Like they didn't accumulate it over time.
Okay.
It's whatever it is, it's got a gift and a curse with it, right?
Okay.
So if you have really high arches, you're more likely to get hammer toes, and you can still get plantar fasciitis if you have really high arches. And really flat feet, you're more likely to get bunions. When you're running or towing or whatever, you're creating more external twist with your toes.
And you're
because your
rubbing.
arch isn't pushing off of it. And then that tends to be associated with a little bit of valgus or medial knee movement, so in boys in particular. But most of the fastest people I knew had flat feet, like in college and stuff.
Wow.
So it's not always a one-to-one thing. The way that it's taught, people are like, oh, it should be this or this or this, but everybody's bodies are different. Whether it's just straight genetics or it's a compensation for your hip width, knee positioning.
If you don't do anything about it, it's gonna get worse.
Yeah.
Like the plantar issue
for
of
sure.
grows. I mean, I'm only 34. I'm about to be 35, so I can imagine if I just let this go,
Right.
and just kind of, I'll be fine, where I would be in the next 5 years. Like if it's hurting this bad, where I'm like hunched over, hanging onto the side of the bed, trying to walk in the morning.
It's definitely one of the things that can be super debilitating for people. And then of course it can lead to other issues. If you're limping up with your feet, then you're gonna create pressure on your knees, your hips. That's better now?
Yeah, it does not feel as painful as it started, because it was a little rough.
Yeah, a little rough. Yeah, so I'm in the camp that says like if you're born with like a medium arch, you want to use shoes to maintain that. I don't think trying to strain unless you're like literally walking in sand all day or like if you're a fighter or something where you're literally pushing off on a mat or something, just standing there or walking isn't going to be enough to strengthen your arches or your feet. There's a lot of foot theory out there, right? We have the knees over toe guys, we have the Vibram free toe people, and you have the flat shoe people, and then you have the sneaker people. And I think they're all right sometimes. Not that they're all right, but they're all correct sometimes. But we're humans, right? We have our own biases about it. And so we look confirmation bias for the things that either we have personally or the success stories that we sort of ignore all the other ones and blame the patient or blame somebody else for it, that the theory must be true. But of course, we're humans, we're variable, everything changes. So, for treating feet for as long as I have, we just whatever works for the person, right? And they'll know fairly quickly. So like for me, I do terrible in flat shoes, like Chuck Taylors or Converse. My feet get beat up bad.
And I see a lot of people wear Chuck Taylors like when they're doing squatting, because I'm assuming that you might as well just do it barefoot then.
Well, it depends on what you're doing, right? And it depends on how flexible your hips and knees are. If your posterior chain is so tight that you can't drop down in the hole, elevating your heels will allow you to bend your hips more. That's actually a test we use to see if somebody's like motion flexibility problems are coming from their ankles. I'll have them do a squat with a textbook under each heels. And if they can go down cleanly, if their knee or their hip doesn't hurt, then we know that the problem is actually coming from down here.
Gotcha.
Right? If it doesn't change, then that's not from it. So we use that as a way to rule that area out. So for some people that want to drop down and get more glute activation or their hips back more, having a flat foot or barefoot helps. But obviously tipping forward is going to put pressure on your quads. If you're trying to get more quad activation, you want your heel up. Particularly if you're really flexible back here and you can't activate it, then you would actually put weights under your heels. And some people use that for like eccentric activation to make the tendon stronger too. But if that bothers you, if it actually makes your knees hurt and you can't exercise, then you would want to take that out. So a lot of people feel that having a flatter shoe gets better glute activation.
Like it doesn't feel painful at all. Like when you first started, I didn't know if I was going to be able to continue. But now it feels fine. Yeah, it actually feels okay. Now the outside is tender.
Right. So I'm working to a different area, right?
Sheesh.
So we're on those same lines there. So the typical answer that I give when people ask me about these shoes or whatever, I say it depends.
So what works for one person is not going to work for another. Some people like Nike, some people like Adidas.
Yep. So the only way you really know is by trying a bunch of different things, giving them enough time, keeping all the other variables the same, and then seeing what works best for you. Most people use their feet muscles so much standing, walking, or whatever. Primarily, we're going to be overactive. So most of us need to spend some time breaking up the tissue on the bottom of our feet and then loosening the calves. So the calves and the foot are going to move together to plantar flex, and it's kind of this posterior chain activation. But you can't do too much too, right? So this happens when they do the surgeries where they cut the plantar fascia. It does get rid of the plantar fasciitis. The pain goes away there. But because you don't have antagonistic relationships for the tendons on the front and the back of the foot, now these ones are overactive, and what you'll get is dissociation or instability on the top of the front of the foot a lot of times.
People who have that surgery, can it still come back or no? Once it's gone, once they have the surgery,
they can't have that same problem again, right?
Gotcha.
The tissue doesn't even hardly attach
it's like
anymore.
Double Jeopardy, can't be charged with the same crime.
Yes, exactly.
Okay.
The foot version. But they'll have other problems. So also the same thing can happen by getting too much soft tissue work done. So we have some type A's that have plantar fasciitis that come into our office, right? And we'll be like, all right, here are your exercises. And we have to rein them in because they'll be doing them for 2 hours a day, right? And after doing that for that long, your foot is mush. Like there's only so much muscle tone. And so what'll happen is they essentially do the non-surgical version of having the surgery. So now they're so deactivated on the bottom of their foot that they're not stable enough to hold their foot, and they're getting pain in other areas. And instinctively, they're like, well, if it hurts, I need to push on it. So these are our veteran patients.
Yeah.
We have to be like, just because it hurts doesn't mean you always push on it, right? This is super common with upper back stuff. So they come in, they have levator scapular problems, we teach them their exercises, and then every time they hurt, they go, grab a lacrosse ball or a dip handle, and then get in there or get deep tissue work done, right? But eventually what happens is there's a neutral point we're trying to get to. Too tight, too loose, right?
Yeah.
We want to be sort of somewhere in the middle. And they go from being too tight to way too loose. So they still have pain, but instinctively now they think that pushing on everything is the solution to all pain.
Yes.
But in this case, it's actually making it worse because they're deactivating the tissue more. So this is the posture thing. Like if it feels like really good to push on it, not productive pain good, like you know what that is. If it feels good, we shouldn't be spending more time pushing on it. So people's rhomboids and like their lower traps in those areas, like it feels good, but like like 30 minutes later, an hour later, they actually hurt worse because they've deactivated that tissue more. So now they're even falling forward more. Meanwhile, if you push on their pecs or their anterior delts or those places, it hurts a lot. So that's where they need to do more like loosening and more strengthening in the back. So like for you, for example, you're getting a lot of posterior activation here. Mm-hmm. So strength-wise, sometimes you'll want to do like toe curls, like picking up the, like curling a towel or...
And picking it up, gotcha.
Yeah. But for the most part, strengthening your tibialis anterior is going to help to balance you out more. Some of those patients we have to pull back from the ledge. We're like, okay, no rolling your foot. Too much.
So what do you feel like when you first started versus what you feel now?
So adhesions.
Oh.
Like the tissue feels physically thicker. Like there's still a little bit right there, right?
Yeah, that hurts.
Okay, I'm gonna hold that till it starts to fade. And tell me when it starts backing off.
It's starting to back off.
So when I hold one spot, what I'm getting is like neurological deactivation. So it's turning the muscle off. And when I run like lines repeatedly in one direction, there is some sliding and moving of the tissue itself.
Yeah, I was to say it faded out.
Okay.
Like that doesn't hurt. I know it's supposed to.
So a lot of times when people have plantar fasciitis, their heel is actually stuck and the tissue's out here because a lot of times they're going to be pronators. She's not. So this is why she's not presenting classically. A lot of people that are pronators like that, they're tight on the tissue here, and that'll lock the heel bone down. So the heel bone doesn't move because they're so tight on the outside. Mm. So a lot of times, you know, this tissue here is going to be pretty lit up, like super painful.
Yeah, it's not.
Yeah.
So does she not have plantar fasciitis?
She does, but she has a unique variation of it. It's not the most common.
Wow.
And hers is presenting more through the arch than on the heel itself. And it's because she's not a big pronator, medial knee, person.
Is it also like maybe lack of activity, like lack of working out?
It can come from anything, honestly.
Okay. I feel like it has to come from me wearing flats because that's all I ever wear anymore.
That's probably, if your instinct is that's probably what it is.
And maybe not having like sandals that actually have some type of cushion. It's literally like wood.
And given your feet, I would argue that, even though it is tight there and you do need a little crossbone a little bit, you're the type that's going to need a little more strengthening in your arch. So activating it.
So not necessarily putting an arch support in my shoes.
Right. But that can help.
Okay.
It's not a bad thing. Like people will be like, oh, don't use that. Like, hey, whatever works. And
yeah.
It's like posture braces. We'll have some people in them that gets their body used and not retracting or going the wrong way while they can't resist it, right? If they're in surgery, like a lot of surgeons will wear those. And then when they're not there, then we want them strengthening the muscles. But until you've built them up, letting you go in there and operate or whatever else and letting you fall forward again, you're developing more of a problem there than you're able to get back in your 30 minutes of the gym. So if we can mitigate the problem part first, and then you're getting a net gain by doing the strengthening later on. So even though people be like, oh, don't use that, that's a crutch. Like you need crutches sometimes.
Wow, that made so much sense to me.
Yeah.
So you want to strengthen them, but if they're tired or if you're in a position where it's like too much, then you can give it a rest with arch support.
Yeah.
But maybe not arch support all the time.
Right.
You want to strengthen your feet.
Yeah. While you're in the process of strengthening it, having that Band-Aid or that crutch helps.
Gotcha.
Let's take a look at that arch now. Try to relax it.
Oh. Okay, now that's painful. But I feel like that side got worked out quicker than my right side.
That makes sense. It feels that way to me. So maybe the right was the first one. Like you said, it feels like they both came around the same time, but...
Yeah. Woo. I feel like I just want to like milk the rest of the day. Maybe I can't walk. I can't do anything. I have to rest my feet. My feet have to recover.
I'll vouch for it. So
my feet are healing.
write a note.
Yes.
No housework for Tiffany.
Yes.
Yep.
I have a doctor's note.
Sorry, you just need to lay down and watch movies.
Oh yeah, that.
It's a little different spot.
Mm-hmm. Does acupuncture help any of that?
It can, but I don't find it super consistent in this particular area. Mm-hmm. And most people, so if you heard of homunculus, it's like your brain's representation of your body, like how many sensation neurons you have in each area. Mm-hmm. So like the biggest ones are like in the feet, the hands, the mouth, the tongue, and the genitalia. So most of us have very sensitive hands and feet. So needles are not particularly fun. Like I hate having my feet acupunctured or dry needled. Same with my hand.
Okay.
Like traps, back, stuff like that. No big deal.
Especially that area.
Like right there.
There's like a knot there. It feels like it's worked at that first. It worked somehow. That was rough at first. Okay. I didn't realize I was like squeezing my whole lower half. Like, I'm like, okay, just relax.
Locking everything up.
Yes.
Right there too.
Yeah.
Yep. Okay. So tell me when it starts to fade.
It's starting to fade. Ooh. Yep, that Charlie horse must still be there. You can push my legging up if you need to.
What was that? Push the bat like this?
Oh, yep, if you need to. That is like the exact area that I like hobbled around my house. That was so painful. Position my back.
You okay?
Oh yeah, just my back just arching, but I'm sitting up
Ah.
the way I was sitting.
I thought you were like curling up to like cry.
My body feels so weak lately, and I don't know if it's just because of just the lack, like I said, lack of activity, not really working out, but like I just feel, is this what people talked about, like you're getting old? Like everything aches, everything hurts.
Every generation, like people are like the day I turned 40, I'm like, oh no. And then they're like, then I'll have like a 52-year-old, I'm like, oh, you think 40 was bad? And the 60-something-year-old, I'm like, oh shit, don't do this to me. Like,
It just keeps accelerating.
Yeah,
Yes,
like,
I'm
oh,
like
man.
achy. All right.
you guys are scaring me. Don't do that. Did you put that evil on me, Ricky Bobby? Yeah, go there. Okay, lay back.
All the way.
Yeah. Good. All right. So let's go ahead and stand up and just take a couple steps. Let's just see how it's going on the carpet first and Audie. It's already
Yeah, it's tender.
from me or
This
the original?
one. Probably a combination of both, maybe.
Okay.
But it was mainly this one. But this is the one that I always feel like when I'm in my bedroom, like, that hurts worse. See, even my foot looks different. Like, I can literally stand here, my foot does not look like that. Like, I remember how I told you I felt like I can look and see, like, my arch is falling.
Mhm.
Like, because I think probably obviously what you did and all the work that you did, it literally looks like I now have, like, an arch again.
Okay. Let's lay on your back again.
Okay. Can I push against you?
A little bit, yeah.
Okay.
Okay.
Like that feels fine.
Just
It was
that-
sore when I sat up, but it feels fine walking now. But I don't know if it's because I just walked it all out.
Right, I think so. So stand with your feet facing this way. And then what I want you to do is you're gonna put your weight on your heel, and then shift this hip to the left.
Okay.
Keep shifting it. Go. Go further. Okay. All right, take a couple steps.
Like that feels fine.
How's that arch feel on the left side?
It actually feels like I have an arch.
Feel a little
Like,
higher,
yeah, it does feel higher. It feels like I'm putting more pressure on the outside of my foot than I am anywhere else.
Okay.
Ooh, right on the toe. Whew. Whew.
That's tender?
Yeah.
Super tender?
Yeah. I don't know why either, because I've never had issues there.
I'm almost thinking your big toe stiffness is contributing a lot to this.
That's really tender. So it's probably the issue, like a big toe?
Yeah, looking at your arch movement, I'm thinking like using a gua sha tool on your big toe a lot will help a lot. Like if you can get more flexibility in this, then it's going to change your metatarsal positioning here, which should feel better on your weight distribution in your foot, I'm thinking.
Ooh.
Couple steps.
It feels like I'm walking different.
Yeah.
It does feel, I definitely feel a difference.
Yeah. More centered on the foot, like through the center of it, instead of falling in a little.
Yeah.
On the left at least.
I feel the difference for sure.
Okay. So move the right foot back there. And then we're gonna go. So heavy on this left foot, and then your hips are gonna go to the right.
Okay. So lean?
Bring your hips towards Lais.
Ooh!
A little more. Good. Okay. Let's go back up here again.
Okay.
So foot goes back down. Alright, hips are gonna go to the left now.
Okay. Am I picking up my arch or not?
Try to keep your weight just straight down on the ground here
Okay.
on the side. And
Just
most
push
of it on
my
this
hip.
foot. Yep. Slide your hips to the left. Good. Alright, a few steps again. Let's lay face up on the table again. Just want it outside of that top of this.
That is really a scary feeling when somebody has a hammer near your toe. Because I think usually your reaction is like, no. But. That is really tender.
Yeah, that's our troublemaker on this outside.
Oh my gosh. All right, there's a lot of chiropractors that aren't doing their jobs. Maybe they are, maybe because it's specific to certain things, but.
Right along there.
Oh my gosh, that is really tender. That is really tender. What does that mean? Like, what does it all mean?
It's maybe life.
Yes.
Nobody knows.
Now that feels like it's worked out. Jeez.
Yeah. There we go.
Oh my gosh, I bet you basketball players and I think athletes in general probably have the worst.
For sure.
I guarantee you would cripple Elsie if you started messing with his feet. He would probably melt to the floor.
Just take me out of the right hook.
Oh my gosh.
Well, and the thing about them too is they're conditioned to ignore pain.
Entirely.
And a lot of times they condition their brains to not to block out the difference between good and bad pain? Like, so am I sore from working out, or is it my joint? Like, they can't tell the difference.
So Elsie actually has arthritis in his hands, in his feet.
Makes sense.
And then he's got both hips replaced.
Yeah.
But he actually is walking like with a broken bone. He's had it for years. He played with it for years, everything.
Yeah.
So like even Zaya, her little, well, I mean, I guess 30-pound kid, she steps on it. He's like, Zaya. Yeah, he can see the bone, feel the bone, all of that.
In his foot?
Oh yeah, he's walking like a legit, he's just like, I'm not going to have surgery. I'm going to have to teach myself to rewalk.
Deal with it,
Yeah.
Until they get better stem cells or something. Or... All right.
Am I walking?
Yeah, take a few steps. Did you see about the weight distribution on the left side now?
It feels so much better. It really does. And I'm not just saying that like I just feel better. But I don't know if it's because I kept getting up. You know what I'm saying? Like I'm not laying down for a period of time.
But like weight-wise, does it feel...
It feels lighter.
It feels like it's more, like your weight's more centered on that foot now?
Yeah,
Like
it feels, yes.
when you go
Instead
toe
of,
off.
yeah, so when I'm standing, it doesn't feel like I'm favoring one side or the front or back. It does feel like it's...
It looks like your tibia is more straight through the foot now instead of like the ankle tipping in a little on the left side.
Because I see what you mean, the ankle tipping in.
Mm-hmm.
Ankle tipping in, this one doesn't look like it's tipping in at all.
Right.
But this one does, so...
And it's better than it was a second ago.
I can look down and see it.
That's coming from the outside. So, like she said, she felt like that left arch is dropping a little bit, and that puts more pressure over the big toe also.
Ah, so it's all coming together.
So they feed forward and feed back. They feed into each other. So when I have, you can't see it on me because I have my shoes off, but my right foot pronates a little more. So my right arch dips a little bit, but that puts way more pressure on my right big toe because of that, and then my right big toe gets stiff, and if I don't work on it, I'm gonna get a bunion there.
I never would have thought that my toe would have been associated, or even like the outside of that would have been. I mean, I guess yeah. You think when your arch is falling, you would think okay, it's gonna fall inwards, so that's where you see that. But I never would have thought that my toe had anything to do with
But like
that.
for example, like just standing there, if you push your left knee out, you can see what that does to your arch,
It pushes it, yeah.
right? And then if you push the knee inward, you can see what it does. So that's what we look at too. Is it positional upstream or downstream? Is it the arch causing everything upstream, or is it muscles and stuff upstream causing your leg to move out or in?
Wow.
So you go joint by joint. We look at the calf and the ankle muscle first, and then if that corrects it or it doesn't, then we would move to the knee and the hip and the IT band and the pelvis, because sometimes the pelvis can cause the foot, sometimes the foot causes the pelvis.
Yeah.
Or sometimes they link on each other equally, right? All right, lay on your back again.
Interesting.
Well, that's kind of what he was talking about. Like, things are connected somewhere else, and your shoulders
Yeah,
butting
but they'll do something else, and then it's wow.
which is sometimes needed, and sometimes they're just showing off that they know that sometimes things are connected somewhere else. So, like, you probably could have worked on the shoulder too.
Okay.
We tend to be a little bit of showmen.
It's tender right there. It is tender right there. Right there.
There
right
too. Oh
Mhm.
yeah. Found some more.
I feel like it's scar tissue from just like a rolled ankle.
Probably.
Oh my gosh.
Probably. Heal life. Okay. Take a few steps again.
It feels better.
So the left side should feel more like you're going through that way instead of that way.
Right in the back is tender. Where your thumb is, yep. Mm-hmm. I don't know if that has anything to do with anything.
Yeah. Let's flip back over again on your stomach. And then scoot down towards me just a little bit. There it was. All right, let's take a few steps again. Then we get that heel bone to move until then. Does the left feel better than the right when you're toeing off right now? When
It feels more flexible.
you're pushing, it rolls through easier
Yeah.
as you move to your next step.
Yeah, it feels flexible. Like this one feels like it's if I'm walking, I'm picking up my heel before I'm even really stepping. Whereas this, I can get more flexion Where this, it's like, okay, I'm walking more flat foot than I am actually, you know what I'm talking about, bending the foot.
100%. Okay. Let's go to when you're back, kid.
Not as, I take that back. I was going to say it's not as bad as the left, but it's tender. The areas of the body that we neglect.
Yeah.
That is very painful.
We don't think about it until it doesn't work right.
Yeah. I just knew getting up in the morning, I'm like, there's no way. I'm like, I'm 34 years old. There's no way I should be hunched,
You're a child.
tiptoeing, you know, out of bed in the morning.
There. All right, take a few steps again.
A longer runway. It still feels tight.
On the left.
On the right.
Right.
Yeah.
Okay. Let's move it. Put your right foot up on here, if you can. Okay. So what I'm gonna have you do is lean forward and bring that knee past my shoulder. And lean back all the way. And you're gonna straighten out the ankle, or straighten out the knee. So scoot that way, yeah. There it was. And then go forward. And back. And forward. And back. Good, give me 3 more.
That is painful. Jeez. That has to be like years of like ankle rolls and scar tissue all built up. Here I am thinking I'm getting old. No, it's scar tissue.
Yeah. I mean, that is, like I said, what we call getting old. Is like when you build up micro injuries and, you know. And back. Good. Okay. Let's do this.
Woo.
Actually, take a few steps first before we do the other one. See if that feels more even.
That, because, yes, it feels looser now.
Yeah. Now it's more of that smoother heel toe.
Yes.
Yeah.
Yeah, I actually feel like I'm like walking and not like.
Not stepping or something.
Yeah.
All right, left foot up on here. Okay, let's go forward. Good, and back. And forward. Well, that pop we got on like the second one on the other side was what it needed too.
For in the ankle?
Yeah, on the right side. And back. Good. And back. Good. Couple more.
This one is definitely not as bad as the right.
And back. Good. And again. Back. Good. And back. Alright, few steps again.
Yeah, that feels like it's like warmed up, like better. But how long is it gonna stay that way?
That's a good question.
Is the thing. You know what I'm saying? Like I feel good now, but
Yeah, it's good now.
yeah, it feels better. Not so tight. It feels like there's more like mobility. And like you said, like no more, it's not like the whole foot's picking up, like, you know, when I'm walking, I actually have like that nice flex in the foot,
Flex on.
but I can feel it.